So hello dear students, FMGE exam is just around the corner and there are certain confusions and doubts that most of you students are happening and you're constantly asking. So I'm making an attempt here to clear that. The first confusion that you have is that does rotavirus vaccine follow open vial policy or not? So please remember, as you all know, that open vial policy is that we can reuse the vaccine vials up to 28 days, okay, provided they are maintained under proper cold chain condition. Now initially the Rotavac vaccine that we had, it had the vaccine vial monitor on the cap. So we used to open it and the cap khol ke we used to take the vaccine and then it was thrown away. So it was not following. But now the Rotavac vaccine that we have has the vaccine vial monitor placed on the label. Okay. So when it's placed on the body or the label, we can reuse again. So that means the new Rotavac vaccine which has come out, it has the open vial policy, open vial monitor on the label and it is following open vial policy. Okay. The second confusion, does Japanese encephalitis vaccine follow open vial policy or not? So please remember again, the Japanese encephalitis vaccine is of two types, live, which is SA14-14-2, which is used in our NIS schedule. That is not following open vial policy. But a new Japanese encephalitis vaccine by the name of Genvac has come up, which is a killed vaccine and that definitely follows open vial policy. Okay, so these were two very important confusions that I wanted to clear. Thank you so much.